Hello, my name is Ashley and I'm going to be your student nurse today, and I'm going to be doing a general head-to-toe assessment. Can you tell me your name and date of birth?
Tabitha Harrison, 9491.
Okay. Do you know where you are?
In the student nursing lab.
Do you know the date, the month and year?
Today's date is November 21st, 2014.
Okay, and are you in any pain?
No, ma'am.
Okay. Patient appears stated age, no obvious deformities, extremities look equal bilaterally, and skin tone appears even, and okay. So I'm going to start from your head and work my way down, okay? You start in your head. Just make sure I don't feel any bumps or bruises or masses. Feels symmetrical. Skin feels warm. It's dry and intact. I'm going to check your temporal pulse, your carotid pulse, Okay, I'm going to check your eyes to see how they react to light and accommodation. So if you'll just look at something over my shoulder. Okay. Now just follow the pen line. Okay. Now I'm going to check the 6 cardinal fields of gaze. So just follow my finger. Good. Okay. Now can you open your mouth and say ah? Good. I'm going to check your gag reflex. Present. Okay. Now, can you clench your cheeks? Muscle tone is equal bilateral. Can you smile real big? Can you wrinkle your forehead? Can you puff your cheeks? And can you stick your tongue out and just side to side? Good. Okay, I'm going to check your trachea. It's midline. Okay. Now I'm going to assess your thyroid. So if you will slightly lean your head forward and to the right, I'm going to. And can you swallow? Very good. Okay. Can you push your face toward my hand? Good. And the other side. Good. Can you do your shoulders? Very good. Okay. I'm check the turgor. It is elastic and a +2. Okay. Now I'm going to whisper something in your ear and repeat back to me what I said, and cover your opposite ear.
B52.
Okay. Do it.
J27.
Good. Okay. Now I'm going to assess your upper extremities. Okay. No tremors or edema noted. Skin is warm, dry, and intact. Check the capillary refill. It's less than 2 seconds. Going to check the muscle strength. Can you squeeze both my hands? Good. Now I'm going to check the brachial pulse, the radial pulse, and the ulnar pulse. Good. Now I'm going to assess your breath sounds. I'm going to listen for 1 full respiration at each breath sound. This is the bronchial, which is the trachea and larynx, and it is a high pitch and loud amplitude. The bronchovesicular, which is the major bronchi, and it is a medium pitch and moderate pitch and medium amplitude. The vesicular, which is the peripheral lung fields, and it is a low pitch and soft amplitude. I'm going to listen to your back now. I would listen for 1 full respiration at each place also. Okay, all breath sounds were clear to auscultation. Okay, now I'm going to listen to your heart sounds using the diaphragm first. I'm going to listen to the aortic and the pulmonic, Erb's point, the tricuspid, and the apical pulse, and I will listen for 1 full minute at the apical pulse. I'm going to listen again with the bell at the aorta, the pulmonic, Erb's point, the tricuspid, and the apical pulse, and again I will listen for 1 full minute. I'm going to listen for bowel sounds I'm going to listen in each quadrant, and vowel sounds should be present in all 4 quadrants every 5 to 15 seconds. Now I'm going to palpate. Skin is warm, dry, and intact. I'm going to palpate for any tenderness, any abdominal distension, and bladder distension. Okay. Now I'm going to move on to the femoral pulse, which is located right under the inguinal ligament and is halfway between the pubis and the anterior superior iliac spine. Moving to the lower extremities, they appear equal bilaterally. Skin is warm, dry, and intact. No edema felt. Capillary refill, it's less than 2 seconds. Can you push your feet toward me? Okay, muscle strength is equal bilaterally. I'm going to check the popliteal pulse. I'm going to check the posterior tibial pulse. And I'm going to check the dorsalis pedis pulse. Good, and this concludes our head to toe assessment. Thank you.